Treatments for back pain. Lower back pain is tied to certain conditions in the lumbar vertebrae and the surrounding bland tissue structures, like muscles, ligaments, and nerves, and even intervertebral discs. Lumbago is the term that defines this condition, which can last a few days or even for weeks. In this article, you learn about a few different treatments for back pain. Some tests need to be done before starting treatment for lumbago. These tests can determine the cause, which is important to rule out more serious issues that can have the same symptoms, such as osteoporosis, or even infections or lesions that require surgery, or in extreme cases, cancer. It is very likely that a large number of people worldwide suffer at least one backache in their lives. Pain can be felt in any part of the back, but the most common pain is experienced in the lower back, known as the lumbar region. This ailment is very common since this part of the body receives the bulk of the body weight. After colds and the flu, lumbago is one of the most common reasons that many people go to the doctor. Most lesions on this part of the back are caused by work, from a job that requires you to regularly lift heavy objects, or remain in the same position for an extended period of time, among other reasons. Acute lumbago can be the result of a fall or from insufficient strength, which can affect some of the muscles and ligaments around the back, and as a result, cause a sprain in one of these muscles. Causes of sudden lumbago. Fractures caused by osteoporosis or arthritic diseases. When the spinal cord is compromised by cancer. Muscle spasms when they remain very tense. Herniated disc, broken disc, or infections that can damage the spine. Excessive force from lifting weight incorrectly. Spinal stenosis caused by stretching the spinal canal. Scoliosis or kyphosis, which is a curvature of the spinal column. This condition can be hereditary and can appear in children and young adults. Strains or tears in muscles and ligaments. Pregnancy. Diseases related to the female reproductive organs, like ovarian cysts or cancer, or uterine myomas. Recommendations to prevent, treat lumbago. Rest and stop doing strenuous activities for a few days to allow the swelling in this area to go down, which will reduce the pain sooner. It is recommended to use a cold compress the first few days, and then apply a hot one, which helps with muscle spasms caused by pain. Some analgesics can be taken especially during the first few days, while the muscles go back to normal. These need to be prescribed by a doctor, and remember that it is not beneficial to your health to self-medicate. Lay in a fetal position with a pillow between your legs. If you like to sleep on your back, you can put a pillow under your knees to keep the legs in a position that lowers the pressure on the back. After resting for a few days, you can start doing physical activity again, since it is not recommended to stay sedentary for a long time. You should only do light activity, trying to avoid lifting heavy objects and moving quickly within 3 weeks of the first appearance of symptoms. If lumbar pain doesn't go away with exercise and analgesics, it will be necessary to see a physical therapist, who can recommend some stretching exercises that are effective for reducing pain and preventing future injuries. The best way to keep this condition under control is through regular exercise and good posture. When seated for long periods of time, you should choose a chair with a back, so that your back is completely supported. This is the best way to prevent episodes of lumbago. You should avoid gaining weight, which can be done by eating a healthy diet based primarily on fruits and vegetables. Home remedies to alleviate lumbago. A very effective home remedy is a gentle massage using a few drops of essential oils mixed with a spoonful of almond oil. Massage in the direction of the muscle for 5 minutes, and repeat 3 times daily. Boil 3 spoonfuls of verbena in a cup of water, wet a rag with this mixture, and place on the affected area with the hottest water you can tolerate without burning yourself. This treatment can be repeated several times a day. Add 10 to 15 drops of tea tree oil to a tub of water, and soak for at least 20 minutes. Cook 3 spoonfuls of linseed oil with 1 spoonful of mustard. Boil and put compresses on the affected area every night until there is improvement.